Hi, it's Dr. Martha, and I am here with 10 Minutes of TCM Training, my podcast. I am going to talk today about the wiry pulse. Now, for those of you who know me and my pulse diagnosis system, we don't focus on the quality so much. It's about the flow of energy through each of the positions and then across the body, so that we get a feeling of a sine wave or a normal pulse at the end of the treatment. That's our goal of every treatment. However, I know people still like to talk about qualities, and occasionally it is important to think, that pulse feels a little bit wiry. What is going on there? So let's talk about it. And some of these descriptions are from the classics, and some of them are just the way I currently talk about the wiry pulse. So I tell my patients it feels like a guitar string. I'll tell them, as I've explained to you, the normal balanced pulse that I'm looking for at the end of your treatment feels like a stream flowing, a gentle stream flowing. But right now your pulse is feeling more like a guitar string. And so that gives them a visual of what it's feeling like to me. And it means tightness. It means wiry. For me, it means the energy, the chi in blood, the oxygen in blood is not flowing well. A stream is flowing well. A guitar string is not. Now, lots of times you will read that a string-like pulse or a wiry pulse is associated with diseases of the liver and the gallbladder, or hyperactivity of liver yang. Now, again, I don't think that's necessarily true. It can be true, but it's more important to understand that it's not just in the liver and gallbladder sector. It's all over lots of times. So it's affecting everything. You cannot say it just belongs to one particular organ system. I mean, for one thing, it can mean phlegm or pain. So for some to suggest that it's only a liver and a gallbladder thing is just wrongheaded. In Western medicine, for example, you might see a wiry pulse in hypertension or chronic bronchitis, or, as I just mentioned, some sort of condition that's leading to severe pain. So it's a lot of different things that the wiry pulse can mean. It can mean yin deficiency for all we know. So, it's going to feel like a guitar string instead of like a wave. It is not going to show any wave-like sensation. So this means that the yin and yang are not dispersing. They are kind of stuck in one place. So looking at it this way, we can see that the energy is stagnated and it's becoming kind of more concentrated instead of flowing like a river or a stream would. Now, if you feel it, for example, across all the pulses and including in the spleen and stomach, well, then the earth might be getting damaged, right? Our earth, our spleen, stomach, our digestion. So we want to see how it's affecting all of the other organ systems. Maybe if it's a little more rapid and wiry, it can mean excess heat. Or on the other hand, slow and wiry, meaning excess cold. If it's kind of wiry and floating, maybe it means phlegm or some sort of stuffiness in the chest. And it can be a headache, right? Wiry pulse can mean pain from a headache. So one way to look at it is that it is in the Xiao-Yang type of yang energy. That would be heat, right? Skin surface, pain or heat in the sinews, tendons, or connective tissues. We, again, look at maybe where it is most concentrated to see where the oxygen in blood or the organ chi in blood are not harmonizing. Why is there tension in that particular area? And as I said, when you feel it, it's like you're putting your finger on a tight guitar string. It vibrates, but it's tight and tense at the same time. Sometimes it feels so tense that it just feels like it could almost break. So I also would call this an urgent movement because, as I said, the stream, the sine wave, the balanced normal pulse is more like a nice flowing stream. This is much more tense with what I would call very little real energy flow. So that's why I say that it's a little bit of an urgent pulse, because it means that there isn't any real energy flow going on in the person. So we know it can influence all the organs. So that's why we need to look at it as something other than just a liver gallbladder thing. Now, if it's more on the upbeat, it's more yang, right? And if it's more on the downbeat, it's more of a yin thing. So looking at that, sometimes it's a Sanjiao thing. I think the Sanjiao channel is grossly underused in our practices. When I feel a wiry pulse under all the positions, one of the first things I think about is how the jiaos, the organ systems, are not communicating with each other. Kidneys aren't communicating with spleen, stomach, et cetera, et cetera, et cetera. Well, the Sanjiao is about connecting things. So we need our Sanjiao channels to be strong. We don't need them affected by stress. And I do think that sometimes, especially when our nervous system is exhausted, which in my method of pulse diagnosis is the right kidney sector and the Sanjiao and the central nervous system, we need to build it back up. And then what can happen is you get that tension when the nervous system is exhausted. You get that wiry pulse. Might be weak and wiry, but it's still wiry. And so we don't need that Sanjiao stress going everywhere else. We need to relax the Sanjiao, open the Sanjiao, and connect everything. Now, remember, sometimes a wiry pulse might be associated with wind. And again, you might discover that by talking to the patient about what other symptoms they are having. But again, the wiry and wind, but that would be something that we would need to address. And again, we would find out by talking to the patient about what other symptoms that they are having. So again, if it's most prominent in the right middle position, spleen, stomach, earth, then what's going on in their stomach and spleen? Maybe they have some pain in the abdomen. So again, look at where it is. Sometimes it's all over. That's what I find most of the time. The wiry pulse is throughout all the positions. And so again, in my method of pulse diagnosis, in my system, we talk to the patients a lot. I feel their pulse. I talk to them about what's going on in their body, because one pulse feeling can mean a number of different things. So this is where it's important to talk with the patient and discover, is it an old thing? Is it something that they've had in their life for a long time? Is it more of a recent feeling or a recent symptom? And all of that can be partly determined by, while you're holding the pulses, speaking with the patient about what you're feeling and asking them questions. Do you have any pain? No. Okay, well, then we can think, well, the wiry doesn't mean pain. If they say, yes, they have pain, is it on the front of the body or the back of the body? And that will give us more information about what we're feeling in their pulses. So there you have a bit of information about what the wiry pulse means, especially in my system of pulse diagnosis. Again, this is Dr. Martha Lucas. My teaching website is lucasteachings.com, and my private practice site is acupuncturewoman.com. I practice physically in Denver, Colorado and Littleton, Colorado, and I offer virtual treatments all over the world. If you have questions, you may contact me at Dr. M. Lucas at acupuncturewoman.com. That's DRMLUCAS at acupuncturewoman.com. Take care and enjoy Chinese medicine.